Welcome to the Treatment Planning, Plan Implementation, and Reporting of Progress module in the Training for Community-Based Living Arrangement Certification by the State of Nevada Department of Health and Human Services, Bureau of Healthcare Quality and Compliance. There are three main goals of this training. First, to ensure standards for the treatment planning process. Second, to make sure that each individual served has a written, person-centered, comprehensive individualized support plan based on his or her goals, preferences, strengths, and needs. And then to make sure that individualized support plan directs the individual's level of functioning in the areas of living, working, health, and socializing so as to increase his or her empowerment and independence in the community. Each client's goals will have certain focus areas. These areas include crisis management, symptom management, rehabilitative or habilitative goals, basic living improvement such as food, shelter, and clothing, educational goals such as getting their high school diploma or enrolling in college, independent living skills such as cooking, cleaning, shopping, riding a bus, and social skills, and employment goals such as writing a resume, looking for a job, and interviewing skills. There are certain standards of service that you must live up to as a community-based living arrangement provider. You must have a process to ensure timely and professional communication with treatment team members, and this includes family, guardians, healthcare providers, and mental health agencies. You must monitor service agreements and contracts, as well as ensure adequate staffing to meet authorized staffing ratios and supervision needs of the individuals as outlined in their contracts and their individualized support plans. And your organization must support a culture of teaching, mentoring, and partnering with each individual, as opposed to a caregiving model where you do things for each individual. You must teach your CBLA clients to take responsibilities in their home and encourage them to participate in all aspects of home and community life. You need to give your clients opportunities for decision making. Your CBLA staff must engage with, listen to, and converse with the individuals you are supporting. Your organization must ensure that clients stay connected to their natural support networks and the life of their communities as defined by their individual support plans. Your CBLA organization must support continuity of individual routines, health and welfare supports, staffing, living arrangements, and general service delivery. You must involve individuals in the decision-making process and in staff performance. You must respect the choices of your CBLA clients. If your clients' preferences are different from the standards of care, those preferences must be documented, such as they prefer dim lighting, limited bedding, etc. You must report on the progress, or lack thereof, of your clients, not just make observations. You must document obstacles to their progress, and document and report on the achievements of their planning goals. Your organization is expected to meet the terms of each individual's support plan and provide contracted services. And finally, you must agree to the provider agreement for all contractual services. This is the end of the Treatment Plan and Progress module for the Training for Certification of Community-Based Living Arrangement Service Providers by the Nevada Department of Health and Human Services. You can now return to the NV eLearn webpage for this module and take the quiz to test your knowledge. After passing the test, a certificate of completion will be unlocked for you to print and download.